You said the majority of your patients are diabetics. How successful are you at weaning them off medications? What kind of concerns do you have about, obviously if they're on insulin, I don't know, are they still using, I'm forgetting the class of drug. Anyway, what kind of issues do you have with weaning people off diabetic drugs?
Yeah, it depends on the patient. Usually when the patients are taking, the first thing that we have to do is to establish if the patient is pancreatic sufficient or not. Mm-hmm. That's the first thing. So if the patient is hyperinsulinemic, is type 2 diabetic, then there is no worry about the problem when removing medications. If the patient is suspicious to have pancreatic failure, then we have to study more and to check the C-peptide and insulin. If the patient has low insulin, low C-peptide, this patient is having pancreatic failure. So it's a different kind of patient. It's a type 1 diabetic. It's not any longer a type 2 diabetic. So our mainly what we treat is type 2 diabetics. So in type 2 diabetics, we can remove medications. The first drugs that we remove are the flosins, the ones that decrease the elimination of sugar through the urine. Those are problematic because they can create one thing that is called normal glycemic ketoacidosis. Mm-hmm. So we remove those immediately. And then we remove also sulfonylureas, mm-hmm. that is like glipizide, and these medications increase the secretion of insulin because they create hypoglycemia. And with insulins, we decrease the insulins in percentages. So sometimes we decrease 30%, sometimes we decrease 50% when we start the ketogenic diet. And it's very successful. I mean, not everybody goes, we stop insulin, but in the majority of the patients, we stop insulin. And usually the drug that we still use in the patients is metformin. Metformin is very good medication to combine with the ketogenic diet.
You mentioned, some of the type 2 diabetics go on to develop pancreatic failure. They stop secreting insulin to a significant degree. Their C-peptide falls. And you said you mainly treat the type 2 diabetics. What do you do with those people that have had pancreatic failure? Is there any utility for the ketogenic diet in that group?
Yeah, sometimes we find these patients because they come diagnosed as type 2 diabetics, but they are taking long-acting insulin and fast-acting insulin. So they are in a bolus, basal bolus regimen, but they are considered type 2 diabetics. And in these patients, we see they are thin. They come differently. They are not obese. They are thin, or they at least are not super obese. And what we do with these patients is, if the patient is a type 1 diabetic, what I do in reality is I check the patient and I see the experience that the patient has managing diabetes himself. If he has understanding of the diabetic medication and he knows how to manage the rapid insulin, and I can teach them how to decrease the carbohydrate load and how to decrease the insulin. So I have done that, but I have to make sure that the patient is experiencing the condition that he has. If the patient doesn't have experience or doesn't have good understanding of what is happening with her body or with his body, I don't enroll the patient in the ketogenic diet for the moment, because a lot of these things depends on the patient.
Yeah, makes sense. I mean, could you get into trouble with that if they overdose on insulin and they end up putting themselves in a hypoglycemic coma? That would certainly be a problem. Are you seeing any sort of, if somebody's got waning pancreatic activity, say the relative borderline low C-peptide, do you put them on a ketogenic diet? Do you ever see that recover? Have you seen that recover at all?
Yes, I have seen it, but just in the C-peptide production. So we see increase in C-peptide a little bit. For example, from less than 1 to 1.2, something like that. Mm-hmm. We have seen an increase in C-peptide in patients that are type 2 diabetics, that they are developing pancreatic failure, but they are still sufficient to tolerate a ketogenic diet, because the amount of insulin that the patient needs to tolerate a ketogenic diet is not much. So you only have to control ketones and control protein with insulin. So if the patient has borderline pancreatic function, they can do the ketogenic diet, and we see that they tolerate the ketogenic diet, they tolerate the reduction of medications, and we see increase in the production of C-peptide and insulin in the patient. But I have documented this case only one time.
Have you you mentioned you mentioned cancer about 1.2 grams per kilogram. So I assume you're seeing some cancer patients then. How are you managing cancer patients? Are you managing them with a ketogenic diet, and what have been the outcomes of that thus far?
Yeah. Yes, I'm managing a little bit. It's not my main practice. I have some patients with cancer, mainly patients that have metastatic cancer, that is disseminated cancer. And they are doing well with the ketogenic diet there. Some patients combine the ketogenic diet with chemotherapy, and it makes better. I mean, the patients get better results. And one of the most important things that we do with the ketogenic diet is that we try to decrease the side effects of the chemotherapy. So this is the first thing, because when the patient is in ketosis, the cells are protected from the chemotherapy a little bit. This is what basic research says, and is what we see in the clinic also. So they have less vomiting, for example, less nausea, less vomiting. They feel stronger in the post-chemo, in the days post-chemo. They recover faster from the chemo. So this is everything that is good. But there is another aspect of the ketogenic diet that it weakens the cancer cells. So if you have the cancer cells are weakened by the lack of energy that you are creating with the ketogenic diet, and then you give the chemotherapy, you hope to have more killing of the tumor. And this is what we have seen in a limited amount of patients, but with PET-CTs, we see that there is less, almost remission in the PET-CT with the chemo and the ketogenic diet. And we also, I mean, I didn't do it, but the team of the oncologists, they did also the immunotherapy. So they did immunotherapy, they did chemotherapy, and I did the ketogenic diet in the context of the therapy, and the patients do very well with that.
Yeah, anecdotally, I've also seen a number of people that have gone through chemo and they've been on low carb carnivore diets. And they say that they tolerated the chemotherapy extremely well. They were, in fact, their oncologists were very surprised that they had almost no side effects at all. Which again, it's not a good situation, but it can make that certainly better. Do you see any utility for diet on mental health? Are you seeing depression, anxiety, things like that improve with diet changes?
Yes, I think there is an improvement in mental health in the patients. I haven't studied, it's not really clear from the clinical point of view that there is an improvement, because I haven't treated patients like a very, very sick in the mental health, like for example, schizophrenia patients. I haven't studied really the schizophrenia, for example, or bipolar disorder or anything like that. But there is an improvement. What I can tell you of the mental health is that the patients that have a lot of problems trying to do a diet because they have a lot of anxiety or they have a lot of obsessions about food obsessions and all of that. When you do the ketogenic diet, you have decrease the cravings in the patient, and the patients feel more capable of doing the diet. So it makes the diet, or to do the diet, more easy. And from the mental health aspects, I cannot tell you clearly that there is an improvement, but I can imagine that there is, but I haven't seen it like clinically really, like really clearly. I haven't seen it in the patients.
Is there a difference? Obviously, you mentioned PCOS, but I mean, are you finding any different approaches for the diet or the therapy in general between men and women that you do this with?